Good morning. My name's Neil Clark. I'm from the Health Authority in Abu Dhabi. We've had that overview then of the United Arab Emirates, and I'm going to focus a little bit more now on the requirements for Abu Dhabi for the next 20 years. Hopefully what we're going to give you is a taster of our full capacity master plan that will identify the needs of hospitals, clinics and facilities for the next 20 years, which I hope for developers, investors and providers, that's really your business plan now for the next 20 years to support Abu Dhabi. So the reason why we've done the capacity master plan is to identify the healthcare demand needs for Abu Dhabi for the next 20 years, identify the current capacity, the future needs, and therefore identify the opportunities and the gaps going forward, which we hope to communicate to investors and private providers to come and help fill some of those gaps. We'll do a very quick overview, some of the population, we've seen some of the details of this already, and then we'll go on to our health service supply and demand. One of the things just to point out is the UAE is a top performing economy in the Arab world, and it's 17th placed in the overall international standings. And Abu Dhabi GDP growth averaged 13% annually. It's a growing economy. And as mentioned earlier, we are diversing away from oil economies and trying to find other ways of making a sustainable future for Abu Dhabi and the United Arab Emirates. Population trends. We've got an increasing number of live births and increasing life expectancy. Expatriates account for 80% of the population in Abu Dhabi. We've seen an average annual growth rate of the population of 3.5%. We actually think that's actually been slightly higher than the predicted figures of 3.5%, so we're seeing a higher population growth than what we initially expected. The predicted population will grow to 4.6 million by 2035. That's nearly double what it is now. So as the population doubles, as the population ages and lives for longer, we're going to see an enhanced requirement for more healthcare needs. This just demonstrates the nationality projections. The dark blue is the nationals and the light grey the non-nationals. And we can see 2015 to 2035, those growing populations. We can also see it in Abu Dhabi. We have three different regions of Abu Dhabi: Al Gharbia, Al Ain and the Abu Dhabi region. And we can see the population sizes for those three regions also growing over the next 20 years. Not only can we see the population growth at regional level, we can see the population growth at precinct level. So in Abu Dhabi, we have about 130 precincts, and at each precinct level, we know what the population expected will be over the coming years. And for example, on the graph I'm showing here, we've got Zayed City in 2015 with no population, but it'll have a population of nearly 200,000 by 2035. So we know we work with the Urban Planning Council, we know where the new developments will be, and we know what the population requirements will be for those new developments. And therefore we can plan, as they plan those new towns and new precincts and cities, we can plan the healthcare requirements to go with those as the population moves into those. Our population profile. So this is the Abu Dhabi region. You'll see that we've got, as mentioned earlier, we've got a very small elderly population at the moment. And quite a large male population, predominantly due to the expat workers, male expat workers. And so therefore we've got quite a low average age in the Abu Dhabi region. That's reflected in Al Ain. And then in Al Gharbia, which is more the industrial region, very few females and lots of males over there doing the work. So we've got a young population in Abu Dhabi. Even if we break this down just for the nationals and take out the expats who were just here for their working lives, we've got a very young population in Abu Dhabi. So the health needs for the elderly will come in time, but at the moment probably our challenge will be maternity, neonatal. As we've got a young population, that's a growing population. Some statistical highlights: 2.76 million residents, 20% of those are nationals. Median age is 19. 38,000 births and 3,000 deaths. 14.95 million episodes of healthcare, which was 91.6 million activities of healthcare in 2015. We've currently got 7,500 physicians, 1,300 dentists, 16,500 nurses, 1,800 licensed health facilities, including 45 hospitals with just over 4,000 beds. We can see there's 22.1 million claims submitted, and 99.1% of those claims, as you would expect, were for outpatients. So inpatients clearly is a small proportion of the total number of claims, but a more expensive proportion. There are 42 licensed payers who provide health insurances and 3.5 million insurance contracts. What we have is we work through, we appraise our overall health needs and we define that by geographic areas, by specialities and by service types to identify what the future requirements will be for Abu Dhabi. And the way we do this is we identify what our healthcare supply is. So all the current providers are licensed in the HAAD database as providers. So we have the detailed information of what they're licensed to provide. And we supplement this detailed information we've already got with an annual survey, and we go back to the providers and ask them, what is it you provide and how do you provide that? And then we also supplement that with the knowledge engine of what the claims are. So we can see, well, we know what you're there to provide and we can see what you're claiming, so what you're doing, and it gives us quite a robust feel of what our healthcare supply is currently. For demand, we take data from OECD countries, mature health countries, and we take their data and identify, well, what's their needs, what's their demand? And then we reflect that data back into our population, which is much different than their population. Predominantly, we have a younger population, so some of the elderly care needs are not as great as they would be in countries like America or the UK. We then apply to that the West Asian burden of disease onto that population. And because we have the population profiles at precinct level, age, sex, nationals and non-nationals, we can grow that population, we can model the growth of that population over time to give us as best possible what the likely needs will be for Abu Dhabi over that period of time. So the reference data times our local population and our local burden of disease health needs gives us what our expected demand will be. And then clearly then we can look at the demand and we can take in the supply and we say this is the gap. And when those gaps will be and where those gaps will be. We have 4 tools we've developed which give us the actual supply, the second one then gives us the demand modelling, the one gives us the gap, and one at the bottom right hand corner is a public module. And this allows anybody, public and providers, to go in and see what facilities are being provided where and what information is available on those facilities, how you can book an appointment at them, where they are, the location, how many doctors they've got, etc., etc. That tool will be developed further and further over the coming years as we provide more information on the facilities we've got to give the patient informed choice of what the options are for them to receive their future treatments. Our current supply, we can map out the doctors, nurses and allied health professionals by the 3 regions, and then we can also show on the graphs here the beds, non-acute beds, acute beds, consulting rooms, also by the regions. So we know what we have and we know where we have that information. All these slides that I've got on this presentation are part of the Health Authority Abu Dhabi Capacity Master Plan. They're all available on the HAAD website with many more slides that I won't be able to go through today. So let me just give a few examples. So we've done this modelling in a number of areas. One of them is acute overnight care. This is where the patients are admitted to a hospital overnight to receive their care, which is different than daycare, and we have a separate set of slides which would look at daycare requirements. But acute overnight care, we know that we've got 3,942 functional overnight beds, and we know that 2,800 of those are for adults and 1,100 for paediatrics. We also know there's 466 non-functional beds in the system, i.e. beds that are available but not staffed or not utilised currently. So if need be, at a push, we could work out how we can bring those non-functional beds to become functional. I said before, we can see the public-private split, and I can also see at the bottom left-hand corner the type of beds that we've currently got. Many of the beds will be able to be changed by type relatively easily, some won't be. So some beds, ICU beds, maybe obstetric beds, it's harder to move those into a different specialty. So we know the types of beds we've got and therefore where we can take those to. And we can split that again by the regions. We know the demand, and this is how we said before how we work on the demand, and we know that the demand will grow at 3.8% per year. We're going to need 144 more beds every year to keep place of demand. And we know what types of beds we'll need. Psychiatry, neonatology, obstetrics, orthopedics, and there's a full list of the types of beds that we need. We know that we can break down that requirement by adults and paediatrics, and we can also see in the bottom left-hand corner, I know what supply is in the pipeline. I know who's currently building and who's developing. And to bring this into the information, there's a lot of people who set off on a journey to deliver something, but never start the build for one reason or another. I include on the information here those who are actually building up and running and the building started. So I can see there's 1,000 more beds going to come into the Abu Dhabi region, 452 more into Al Ain, and just 23 more going into the Al Gharbia region. And that gives me then the future requirements. And you'll see in this bottom right-hand corner, it's telling me actually I don't need any beds in Abu Dhabi until 2035. I've got sufficient beds. And the reality of it is I probably do have sufficient inpatient beds, but probably not the right types. So detailed information within here says I might have lots of gen med beds, but I haven't got enough obstetric beds. I haven't got enough psychiatry beds. And we can do that for each region. So Abu Dhabi and Al Ain probably do have sufficient inpatient beds, but wrong types in some areas. But Al Gharbia already, the western region, already doesn't have sufficient beds. I can do this for all the different specialties at a regional level and at precinct level. But clearly we wouldn't necessarily have a hospital in every single precinct, so we can map out where the most logical place for a hospital would be based on the demand. And people often come and see me or the team and say, can we take some advice? We're thinking of building, we're thinking of doing something. What is it we need? Where do you need it? And we have this information available to kind of guide people through. I'm just going to do one more quickly one. There's primary care. Now, primary care is going to be a really important factor going forward. Currently in Abu Dhabi, we have what I would deem as reactive medicine. You're ill, you'll go and see a doctor. And we need to move to preventative medicine, where the doctor becomes part of your lifestyle and he guides you through nutrition, healthy living, and he avoids you becoming ill. So we've just recently developed our first primary care standard, and we've defined this is what primary care will be in Abu Dhabi. That was developed by an expert panel of primary care physicians from the public sector and the private sector in Abu Dhabi, basing world-class information we've got on how primary care works in other areas. So we're starting a journey to start licensing clinics now as primary care clinics, where we want to see more preventative medicine and try and reduce, therefore, the burden and the cost on secondary care. Again, we can identify by the regions how many clinics we'll need. And for clinics here, you could take a clinic, we model the clinic as being available 8 hours a day, 5 days a week. So it's basically a clinic or a physician to man that clinic. So we can see how many of those we need and where we need them. We can also see that for primary care, the growth is going to be in the region of 7.3% annual growth per year, which is 67 rooms every year. And next to 1,327 consulting rooms will be required over the next 20 years. I can identify, particularly for primary care, every single local precinct should have its own primary care provider. We can identify the populations that haven't currently got primary care, and so therefore where the priorities are. And we invite private providers to come and provide those, and if we don't see a step forward in that, then we'll speak to the government about the public sector providing those services. For those people who do want to invest in Abu Dhabi, we do have some resources available. We have on the website also the health regulation laws. Important to know how the laws regarding health regulation in Abu Dhabi. We have the Health Authority Abu Dhabi policies, and on here we'll have policies on primary care, on long-term care, etc. that you probably want to have a look at if you want to move into these markets. We also have details about how you license your facilities. So a facility has to be licensed, and in addition a professional has to be licensed. So we have details as to how to do that and how to work through that process. Health insurance, to get paid, you're going to have to work with the health insurers to make sure you get paid for the services you provide. So we have details as to how that process works, along with the data standards and procedures to how you submit your claims to get your payments. I was going to give you a presentation on a small demonstration of that mapping module, but probably running out of time, and we've got some IT challenges getting that up. But again, that's available on the HAAD website. So there's a lot of information available on the HAAD website for you. I would welcome discussion with anybody who wants to provide services or deliver services in Abu Dhabi to come and speak to the Health Authority, and we can give you lots of information about what we need, where we need it, and when we need it. Thank you.
Thank you. With regards to public-private partnerships, since our next presentation is on public-private partnerships, could you please explain a little bit more about what HAAD is doing to promote those kind of partnerships? And because that's what everybody's getting into, especially in this part of the world. So what's the HAAD approach to the Triple P?
So we've got a public sector HAAD providing services, and we've got private sector providing services. And many of the services that we've had developed recently have been in the private sector. HAAD themselves have got their own plans to enhance their services, and they've got their own prioritisation as to how they're going to deliver their improvements. We have Mabadla, who work across the public sector, who work with private providers. So we've had a number of PPP services come in. One that probably most people have heard of will be Cleveland Clinic Abu Dhabi. So that's a public-private partnership arrangement, and it's providing world-class cardio, thoracic and neurological services for the patients of Abu Dhabi and the wider emirate. And already we see for Cleveland Clinic, we've brought a big name into the UAE. Already we see, because of that big name, we see medical tourism starting to climb across. Next year, you mentioned medical tourism before. Next year, Abu Dhabi has got a world conference on tourism, including medical tourism. It's a 5-day conference to be held at the International Exhibition Centre, and we'll be showcasing the work we're doing with places like Cleveland Clinic as to how can we improve the experience for medical tourism, working with health and working with companies like HAAD. We're going to do the visas, the transport, the hotels, the accommodation, and the whole medical tourism packages. There are opportunities, therefore, for PPP, but there's also opportunity for people just to be private investors on their own right. And we do have a lot of people coming forward saying we want to get into the market. It is a rich market. We're fortunate that I think because we've got rich information, people want to come and join this market. But there's plenty of opportunities within there, and we can direct people to say these are the services that we require within that market. Thank you.
Thank you.